Hello class, this is my pathophysiology presentation about endometriosis for physiology by Megan Wilkes. What is endometriosis? According to the Mayo Clinic, the definition of endometriosis is an often painful disorder in which tissue similar to the tissue that normally lines the inside of your uterus, the endometrium, grows outside your uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and the tissue lining your pelvis. Rarely, endometrial tissue may spread beyond pelvic organs. What causes endometriosis to develop? Endometriosis affects more than 11% of women from the ages of 15 to 44, but is especially common in women in their 30s and 40s. Having endometriosis can also lower a woman's chance of becoming pregnant. Endometriosis occurs when the endometrial tissue grows on a woman's ovaries, bowel, and tissue lining the uterus. Typically, the tissue will not spread past the pelvic region, but there is always a possibility that it could. Where exactly does endometriosis occur? The diagram is straight from the Hopkins Medicine website and shows a clear diagram of where at in the body endometriosis occurs. The ovaries, fallopian tubes, uterosacral ligaments, the posterior and anterior cul-de-sacs, the outer surface of the uterus, and the lining of the pelvic cavity are the most common areas, and the remaining sites are less common places where endometriosis would be found. What are signs and symptoms of endometriosis? According to the Women's Health website, there is a wide variety in signs and symptoms which could range from no signs and symptoms at all to very severe. Pain is the most common symptom and can vary from person to person. A woman may experience very painful menstrual cramps that may worsen over time. Chronic pain on the lower back or pelvis, pain during or after sex, intestinal pain, painful bowel movements or urinating during menstrual periods, bleeding or spotting between periods, infertility, stomach problems such as diarrhea, constipation, bloating, or nausea, which may worsen at the time of menstruation. With the signs and symptoms being so broad and are similar to other everyday activities, many women go without knowing that they have endometriosis and believe that the painful periods are normal, so they do not think to mention it to a doctor. Diagnosing endometriosis. In order to be properly diagnosed with endometriosis, your doctor will do a complete history of your signs and symptoms, as well as discussing any family history of endometriosis. A physical exam will most likely be completed so the doctor can check for any cyst or scarring behind the uterus. Following the physical exam will be some sort of ultrasound. That can include a transvaginal or abdominal ultrasound. If there are still no clear findings, the next step would be to have a laparoscopic exam in order to see the region more clearly. If it is found that there is indeed endometrium during the procedure, they can remove the tissue right then and there. Treatment options. On the Johns Hopkins website, there are a couple of different treatment options discussed. Some of these options for a more mild case may simply involve pain medication or observing to make sure the problem is not getting worse, or hormone therapy using oral contraceptives, testosterone, or progestins. In more severe cases, treatment options may include a laparoscopic procedure to remove the endometrial growths, a laparotomy, which is a more invasive surgery, where they will also remove the endometrium tissue, but it could not be resolved laparoscopically, or a hysterectomy could be necessary if there is too much damage. This would result in the removal of the uterus and possibly ovaries. Is there anything I can do to prevent endometriosis? Unfortunately, there is no way to prevent endometriosis, but there are things a woman can do to lower the chance of getting it. Keeping lower levels of estrogen in your body can help lower the chance of getting endometriosis. This can be done by certain types of birth control, exercising regularly, avoiding large amounts of caffeine and alcohol. Studies have shown that drinking one caffeinated drink a day can rise estrogen levels. Drinking no more than one alcoholic beverage per day is recommended for women who choose to drink. And exercising more than 4 hours a week will help keep lower body fat levels, which will decrease the amount of estrogen. And this concludes my presentation. Thank you.